like changing a diaper. I was like, ah! Like, oh my God. The JP drains full of feces. I've never smelled anything like that in my life, ever.
Hey guys, welcome to Nurse Talk, the podcast where we talk all things nursing. My name is Mia, and today we have Genesis.
Hi.
Before we get into today's episode, I would just ask that you guys please like
And subscribe.
Yay! Okay, so I always start every interview with why nursing.
I didn't really think much about becoming a nurse. It was not on the top of my career choice. I kind of fell into it by accident. I was waitressing when I was like 16 in a retirement home. So like all the residents would come and like eat at this restaurant, and a certain couple just took like a liking to me, and like their caregiver approached me being like, we need a girl to help take care of Mrs. So-and-so on the weekends. Would you do it? And I'm like, I'm 17 years old. Like I go to cheer practice after like school. Like I'm in school, like all that stuff. And I was just, I decided to do it. And I did that for 7 years, being a home health aide.
Wow.
Yes. I learned so much, and I got really close to the people that I was taking care of, and like they became like family. I still keep in touch with some of them. You work really closely with them. So during that time, they were just, the family members would be like, you would make such a good nurse. And I was like, no, I don't want to do that. I don't know. It just didn't occur to me until one day it just finally clicked. Like, you've been doing this for so long and you love it. Why wouldn't you do it? So that's kind of how I got into it. Found me, I like to say, because I did not choose nursing. I feel like it definitely chose me.
That's sweet. So you went straight into NICU, right, as a new grad?
Yes, I sure did, which is crazy because I had only worked with geriatric population. And so I didn't think I would fall into like pediatrics or women's and children. I was like, this is all I've ever known. I like it. I like talking to my old people. Like I like listening to them and their jokes, whatever. I was like, I'm going to get into probably adults, and I'm fine with that. And then I remember my first peds rotation in school, and the first unit that they took me to was the NICU. And I had never really thought much of it. I don't have really any babies in my family. No idea. So I just stepped foot into like magical fairyland. That's really cute. Like it really was. And my nurse that I had, like that was taking me on that night, for some reason before that clinical, I had just decided to like read up on, I don't know, just babies and stuff. So in my textbook. So when I got there, she, like, it was still fresh in my mind. And so like, I guess I was asking appropriate questions, and she was just like, you know, we just got along really well. And I was like, do you guys take students here? Like, do you precept? Do you like, what's the deal? How do I get in here? And she's like, I'll do it. She's like, I'll precept you. And I was like, okay.
Thanks.
Thanks for making my dreams come true. And this almost impossible specialty to get into as a new grad. So her just showing me how to even feed a baby, I fell in love. I really did. And then I precepted there as a student, and the baby, I fell in love. It just clicked. It really did.
Those are like the absolute best populations, geriatric and the babies.
Right.
Oh my God.
Right.
Those are like my favorite.
How do I talk to a person my age as a patient? No idea.
Okay, so how would you describe the overall like culture or atmosphere of a NICU nurse or NICU nurses?
We're very protective over our babies.
Yeah.
If you see someone walking and they don't have like, who are you? Like,
why are you here?
Yeah, why are you here? Who are you here to see? Are you a parent? Are you family? Like, I feel like we're very protective over the babies. And even like other, like, I don't know, even like if I have a really sick baby, like on drips, like I'm just like, please don't touch my drips. Please don't touch my pumps. Like if a flush is going off, let me know. Like I will retime it. Like,
absolutely.
you know what I mean? I feel like we're just very protective, like almost as if like they were my own babies. It can be kind of catty sometimes.
Yeah. Very type A personalities.
A lot of type A personalities. So it's like some nurses' strengths are not going to be your strengths, and that's okay. You just have to find what meshes well with you and your assignment that day. Sometimes you will need to be more type A, and then sometimes you're so busy that it's
Type
like
B it
as
is.
much as type A point B it is. Exactly. But overall, at least where I am working right now, I have nothing but really positive. Like I feel like the positives outweigh the negatives. Things like I feel like units go through phases too, where
Oh, absolutely.
there will be high morale and there will be low morale
And sometimes it takes one person leaving.
to really affect it.
Yeah, or even one person coming in.
Yeah.
One person can really change
The culture.
the culture and the vibe and how people treat you.
Yes. I can say from when I first started to now, it's been a huge shift. As huge.
For me in a positive way. What
For
about
you in a positive?
Oh.
For me in more of like a negative. Maybe because a lot of people have left and a lot of new people have come in that like maybe have, I don't know, like their heart's not really in it, which is fine. You know what I mean? Like, but it's, I don't know how to explain it. They're just like, I'm here to,
Make money and leave.
right. Which I get it. We all got bills to pay, but I don't know. It just feels different. I can't even put my finger on it. I really can't.
Also, there is like certain people who are so particular about things.
Yes.
Be like the blankets have to match, and I remember I got crucified because
You're
one
right,
day
right.
I was like,
Yes.
I was holding on by a thread. I was so busy, and I made a comment, and because I knew the nurse coming on was going to be like, oh my God, the blankets don't match, and I was like, I don't care as long as the blankets are clean. Like that's all I care about. Like I don't have time to go find like.
Right. 1,000%.
Yeah, and I remember I did
1,000%.
get crucified for it because my blankets weren't matching, and I'm like, there's
This
no
is
poop,
not a
pee,
big-
or blood. Like they're all clean.
1,000%.
That's the only thing I can't stand about like. Well, if you
Yes.
if you don't like cute blankets, then don't work here. And it's
No.
like, no. I deserve to work here just as much as you. I just didn't have time to go digging through 1,000 blankets on my shift.
1,000%. 1,000% agree with that. And it's like I told you, it's like your nursing style and my nursing style don't have to be the same in order for me to be successful here. Like maybe like you're better at talking to parents than a nurse who's busy with the presentation of the baby, like making sure the sheets match with, okay, yeah, sure, really cute. I love it. But sometimes you're just not going to have the time.
Yeah.
It's,
But to
Yeah.
bring it back,
yes.
that's like one or two people on the unit.
Yes.
And there's like 200.
Yes. Or it could all, I agree with that. But I mean, we'll get into it. Like me leaving the NICU and coming back, like has really taught me, I don't care what you think. I know I'm a good nurse.
Absolutely.
I know it because the face on the parents, like, you know, like the face that the parents get, like when you're there reassuring them, like you can say, I've seen this before, you know, I know I'm a good nurse. I don't need someone else to tell me that. Although obviously getting that reassurance from your coworkers and getting that good job, you did great today, especially when you're a new grad, meant a lot. But now I can be like, my babies are fine. They're happy.
Do you feel like you struggled? Because I feel like NICU is a lot. It's so many ranges of acuity and all of those things. Do you feel like you really struggled in the beginning as a new grad?
Yes. Yes. So much. I cried a lot going home.
Like, I don't know what I'm doing.
Yeah. It's like, I don't know what I'm doing. I don't know if I'm doing enough. I don't know if I can, like, the emotions of it all, because we work at, like, there's different levels of NICU. And like your level 1s and 2s are more of like your preemie babies. They're learning to eat, you know, changing their diapers, all the things. Whereas opposed to like level 3 and 4, you can get a baby that's post-op. a baby that during the delivery lost, like they did not receive enough oxygen. Like you don't know how long they were without. They're cooling. You have babies, your micro preemies that have the airway of a noodle.
Oh,
Like, you know what I
absolutely.
mean? It was a lot. And I'm just like, I don't know if maybe I could do this. I feel like I was really lucky because I moved to Tampa and I took this job with three of my good friends from nursing school and one of my best friends. We started together in the NICU. So having her there, I would shout out Anais.
Hey, girl.
Hi Anais, I know you're watching. Having her and we would go through this talking to one another, leaving our shifts. We would work together. We're both little new grads, like with our brand new scrubs, like fresh out of school. Like, what are we doing? Like, you know, driving, like carpooling together. And we would just, having her there and having her as a support was so helpful. And she makes me a better nurse because she's so much better at different things than I am. And I'm maybe better at other things than her. And I can just be like, listen, it's okay. We'll get through another shift. Like, come on now. Like, let's just go get Wawa milkshakes after work. Like, it's going to be fine.
Oh, that's so sweet. I did not have that. So I think that probably would have helped because it's so scary to start a new job and feel like you know nothing. Even though I came in with nursing experience, I didn't come in with NICU experience. But to have someone there that is going through the same thing and
Yes.
is saying what you're saying and feels the same, you're like, okay, I'm not crazy, or it doesn't mean
Right.
I'm not supposed to be here.
Right. That reassurance goes a long way.
Okay, so do you have any memorable stories from the NICU you'd like to share?
I have like way too many.
Share them all.
Maybe start off with something like on a lighter note, like,
Okay.
you know, because it's not, I feel like there's a huge misconception that if you work in the NICU or mom babies, that everything is rainbows and sunshine. And when you work in a hospital that helps high risk moms have their babies, you see everything. Especially being like a level one trauma, like we get a lot of those patients, pediatric patients too, that maybe mom was in a car accident or something and the baby comes and is not doing well. But there are so many rewarding moments that I'm sure you know, like just makes it all worth it. Like I can come back and do this tomorrow.
Oh, yeah.
You know what I mean? One of my most recent memorable moments is I took care of this baby. He was like 28, 29 weeks. His twin, unfortunately, didn't make it. So that's why he had to come early. So they brought him out, and he obviously starting off like rough. He had some bad lungs and he had some heart issues. He was intubated at first, and I started taking care of him when he was like 3 days old. So he had, you know, he born, intubated, you know, in the incubator, UVC lines, all the thing, TPN lipids, whatever. And I remember just walking into the room and his parents were like in a little corner, like the room was dark, you know, because we try to keep it low stim for the babies. And the parents were just like huddled in the corner. And I was like, oh, hi. Like, I didn't see you guys walk in. Like, how are you? They're like, we're good. And I was like, I don't know what your guys' plans are for tonight, but at 8 o'clock, it's his care time. Do you guys want to help me like change his diaper? And they looked at me and they were like, we can touch him.
Shame on the other nurses, first of all, but okay. Wow.
I said, yes. I was like, of course, like I'll show you how. They're like, we're allowed to change his diaper. I was like, that broke my heart. He was
Oh,
3 days old in that incubator and no one had offered, or I don't even know, right? I can't even say because I wasn't there. But I was like, you haven't changed his diaper? That to me was like, well, we're going to do it. I was like, how long are you guys here for tonight? We're definitely going to do it. And I didn't know. But at the time, like, I was helping the mom change the diaper and she took like pictures. I didn't even know, right? So I built this bond with them and they asked me to primary, you know, and like in NICU, since the babies are there for months, they can ask you to primary, which means you can sign up to have this baby every time that you work. And I'm not really, you have to be like, we have to have a bond, the parents
Same.
and I.
I'm
in
very
order for
frugal with my primary. Yeah, I'm like,
yeah, I don't just pass out that.
no.
Yeah, I'm very frugal struggle with it too, because it's like, I don't know. Like the biggest heartbreak for me would be like I sign up to primary your baby, and then for whatever reason you think I don't I don't know. She did something I didn't like, and I don't want her to take care of my baby anymore. That would tear me to shreds.
Oh my
That's
God.
why I don't do it.
Oh, no. That would break my heart. I would need therapy. I'd be like,
No, literally.
I'm so bad that someone freaking fired me.
Yeah.
No.
Exactly. So I'm just like, I'm so paranoid about that.
Oh, yeah.
And so when they had first asked me, this couple, they had first asked me, they're like, can you primary? And I was like, I really don't. I'll think about it. And they're like, okay, well, don't worry about it. We're going to his brother's burial tonight, his ceremony. So you think about it. And I was like, I'll do it. I'll do it. What do you want? Like my left kidney? Like what else? My firstborn child? Like I'll do it.
Yeah.
So I signed up to do it, and it was the best thing I've ever done. The best thing. Like I said, I'm gonna hit my 3-year mark, and I've only primaried 2 babies. That's it. And I'm so happy I did. It was so rewarding. That family, I don't know, just the family unit themselves was such a huge example to me of like being strong while your baby's in the NICU and you're dealing with grief.
Oh, yeah.
So I saw this baby grow up through so many different stages of his life, and I feel like the mom would tell me, like, you give me hope, because sometimes the providers come in here and they're so, like, I understand, like, you have so many patients to see. And she's like, they come in so monotone and they don't paint a picture for me. I'm like, well, let me paint the picture. He's going to be with us for a while, but pretty sure he's going to be okay, you know? Like,
Yeah.
it's
You never
so
want to be like, your baby's going to be perfectly
perfect.
fine.
Yeah.
Yeah, but like, if you just give them some hope, like, this is what you're looking
and
at.
you're
This is what's
patient
gonna
with them.
Yes.
You need to be patient with your baby. I always tell parents, you can't treat your preemie like you would treat a newborn, because that's not fair, because he's learning how to live outside of you, when technically he's still supposed to be cooking.
Yeah,
So,
oh, yeah.
so I'm like, let's be nice and let's treat little Davy like like the little nugget that he is, because he's not a chunker. He's not a springing baby, like newborn baby. So
No,
let's
yeah.
be nice. And then it's like, okay, they're like, okay, that makes sense. So, you know, and setting realistic expectations. Like, you know, it's like, you can't tell them like you're going to be here a week. No, your baby will probably spend a month here.
Or two.
Or 2. It just depends. You know what I mean? It's you have to be honest with parents and be honest with them, but also like give them hope. Like, I've seen this before. That's what I would tell them all the time.
Yes.
Where it's like babies would get off CPAP and then they have to go back on CPAP.
Oh,
They're
we
like,
see this all the time. It's okay.
it's like, we see this all the time. It's okay. Your baby's special, but I see this all the time.
Yeah. I know, trying to find the balance of like,
I know, it's like,
yeah.
like your baby, listen, this is the
literally-
100th one. Like, he's doing all the normal things I would expect. Like, what's a preemie if he still needs a little oxygen? Like, you know, if he has a little Brady D sentiment, like, if he turns purple once in a while.
He's doing exactly what he's supposed to do.
He's just taking a hard poop. Listen.
No, literally, how many times have I had to say, like, literally, they can't do more than one thing. Like,
Right.
if they're trying
Right.
to poop, they will forget to breathe
Exactly.
or live.
Yeah, or like,
Like, literally, it's crazy.
he's like, oh, I gotta take a poop. Done. Like, I hand it to the moms, especially the high risk moms. I've had moms where they don't come see their baby in the NICU for maybe a week or 2 because they're fighting for their life in the ICU, you know? And I've had to advocate for the mom. And I think there was one time where I was shocked. Like, this mom, she had lost babies before. So this was her first viable pregnancy, and the baby was in the NICU. The baby was preemie. She was going to be fine. She just needed to grow. She needed time. But the mom was in the ICU, like, lost a lot of blood. She was fighting for her life pretty much in the ICU, from what the dad would come and tell me, and the family members, you know. So the dads too, like the good dads.
Oh, yeah.
The good dads.
We'll say that.
We gotta distinguish
Yeah.
the good dads, you know, like rushing from ICU to NICU to check on their babies. Like,
Yeah.
and I would be like, how's mom? You know, how's mom? How are you doing? It's like, you know, mom's still up there, intubated. And I'm like, okay, you know, just keep me posted. We're here, you know, loving on your baby. And I remember one of the family members, like it was like an aunt or something. She was like, "Can I hold the baby?" And this baby was still in an isolate and a CPAP. And I was like, I think the mom should be the first one to hold. Like mom or dad, don't you? Like,
Yeah, yeah. I'm like,
yeah.
if you ask everyone's permission first.
Yeah. It was just kind of like, let's wait until mom can come and see her baby and hold her baby before, I don't even know, like how are
Yeah.
you relate? Like, that's what I mean when it's
Yeah.
like we're so protective of the babies. It's like, how would you feel? Like, I don't think I would kind of like it. Like, someone holding my baby and I'm like, I'm not even conscious. I haven't even seen her unless it's dad. Like, maybe it's just me. Like, I'm crazy, but no, I
No,
want to
I
hold
would.
my baby
I don't
first.
know. I think I can see both sides where like if I really couldn't come, I would rather my baby. It depends on my relationship with that person.
True.
Because if it's like if it's
True.
a aunt of the baby that I'm like this with, then I'm like I'd rather my baby be held by someone if it can't be me.
That's true.
Just
That's
sitting
true.
in an isolate for who knows how long by itself. But if someone just didn't run it by me or my husband first, and I just like randomly walk in and someone's
Yeah.
holding my baby for the first time, it's not me.
Yeah.
It needs to be like an understanding.
Yeah.
Because
I
that's
feel like
very, I would be so territorial. I'd be like, no.
I agree 1,000%. And I was just like, maybe I just need a little more information. But I'm just like, mom's not here to say yes or no. Because, some moms are very much like I don't even want visitors. I want people to wear masks inside my baby's room, which like I understand. So I was just kind of like, maybe let's wait. Dad, do you want to hold? Like, stuff like that. Where it's like you have to advocate for mom and baby sometimes. Adoption stories where baby, for whatever reason, mom decides like she can't take care of her baby and it's a brave thing that she does, giving them up for adoption and then getting to be a part of that story for those parents that, like the adoptive parents that come in and they're like, this baby's mine. I'm like, yeah, this is your baby. Like, congratulations, mom and dad.
Yeah.
Those stories, like, oh my gosh, they always warm my heart. They're the absolute best.
I
And
literally get tears in my eyes just thinking about it. It's so beautiful. They just come in and they're just in awe. And it's so beautiful because I'm like, yes, be in awe of your baby. Because
yes,
this is
be in
your
awe of
baby.
your baby.
Yeah.
Like, what's the name? Tell me. And it's like you teach them, these grown adults. Like we're adults, but they're more grown adults.
Oh yeah, it feels more.
yeah.
They're like younger than we are, or I am, and I'm like, you're so adulting right now.
You're such an adult. Oh my gosh. Like
Yeah.
you're taking this baby home and it's like they're like, how do I hold them? How do I feed them? I'm like, we're gonna do it together. And they're like, don't leave. Like, don't leave. I'm like, no, like I will stay here. I will help you. Like, like this is your baby. You're gonna be fine. Like just the fact that you even like care that much,
It's a great sign. Yeah.
I absolutely love it. That part. And then you have other parts. The babies are so susceptible to getting sick. And sometimes there aren't even signs that it's so sudden.
Yeah. Absolutely.
All of us like never trust a baby.
No, never trust a baby.
Not even if they're room air about to go. Like,
Literally.
don't be scared of people taking your babies home.
Yeah, we're all scaring everyone. Just like
No, don't be scared. Don't be scared. But you just sometimes when it's time, it's just time. I hate to say it, but it's a real thing that you have to nurses going into NICU have to understand because I don't think I did when I first started. I remember being a new grad off orientation and I came in and I was getting a report and the night nurse had told me like the baby was having events all night. This was another twin story.
Okay.
So I was taking care of two twins and I was getting a report and she's like, twin A is fine. He's like the bigger one. He's doing fine. He has an IV, CPAP, no events, just regular events, right? Second one, events all night. Nothing was kind of being done. And I was like, okay, like that's fine. New grad me, like, what the hell?
You learn the hard way to be like, actually, no, this is your problem on your shift. Why don't you call and get them to bedside? I'm going to go get report on my other baby while you do that. Like,
right. I'm like, why wasn't more being done? Like, I would barge down, knock on the doctor's door. I do that. I don't care.
I know, like, you better come to bedside.
No, I go to the medical worker and be like, hey,
it's me.
Yeah. No, literally. And like, I was like so confused. Like, why doesn't this baby who's super sick, why doesn't he have an IV? Why doesn't he have fluids? Why? I'm so confused. So I remember like the day shift medical team was on, and I was calling and calling and calling and calling. I was like, okay, well, he keeps having events like Brady desats, like he's acting super like not well.
He's given up on life. Can you help me here?
Yeah. Can somebody please help? After all the interventions I could do.
Yeah.
And she's like, I'll be there, blah, blah, blah. Attending finally gets there. I call her to bedside with the fellow, and she agrees with me. She's like, why has nothing been done? I was like, I don't know. Like, I just got a report. And she's like, we're going to do a septic workup. We're going to get IV fluids. We're going to get antibiotics started. And, over Vocera, you call, we're having a workup, whatever.
Code Octopus.
And my educator comes and helps me. Other nurses come, like, teamwork was there. We get this baby started on IV fluids, getting antibiotics, and then all that was done in a I felt like a timely manner, right? By the time I got there. And then the rest of the shift, he was great. When you're new and you're doing all this, and like, this is a baby, it's like, I'm still in awe sometimes. Like, when I'm not super busy and I'm there, I'm just like, I'm so lucky I get to do this. It keeps me coming back every day. I'm like caring for this baby, this preemie, so little, and just, I don't know. I thought he was just the most perfect thing I'd ever seen.
Oh,
I was off for like 2 or 3 days. And then my educator, she texted me and she's like, hey, like, I just want you to know, like, he didn't make it.
oh,
Yeah. I bawled my eyes out.
oh, yeah.
I bawled my eyes out. I was with my family was visiting me from home, and thank God my sister was there, because I was driving and I had to like pull over.
Oh.
And my sister was like, what is wrong? What's wrong with you? And I was just like, I cannot believe this. Like, he started, after we gave him the antibiotics, we got him on IV fluids, we did all the things, he acted fine. But he got neck. So he was sick. So, when neck happens, sometimes it's really aggressive, and there's really nothing you can do. There are studies about this where it's just like, neck is so common in preemies, and sometimes it's really aggressive. There's nothing that you can do.
Yeah.
That is the story that will stick with me forever. And since then, that attending and I have a really good relationship.
Aww.
And every time I call her, she's like, what's up? And I'm like, okay, you're listening a little too hard. I'm just letting you know, like, what I'm seeing. And she's like, yeah, absolutely. You want the order? Let's find an order in for this. Times like that where you work and you advocating for your babies, it like the providers will listen. That's how I feel like you work with your team. And even like, just maybe I don't know, maybe a coworker is like so busy. So you're like, you want me to talk to the provider, or you want me to call them for you? Or what do you want me to do? Like, do you want me to help you with your other baby? Like, or like, when you're like you're busy in a room and it's like, can you check on my other baby, please? Like, I don't know what they're doing. Like, they're gone with the wind. I'm just like, yes, I will go in there. Let me see what's going on. But you have stories like that where it's like, that was so unexpected. I was distraught.
Oh, I would be too.
I was less than a year, like couple months at being a nurse. And I was like, what did I do wrong? What did I not do?
I think it's safe to say, things just happen. But also, I think maybe you'll never really know, but maybe earlier intervention when you weren't there would have probably helped.
Maybe.
You never really know. Sometimes it's just kind of what happens. And then sometimes it can be neglect, unfortunately.
I agree.
But anyway, do you have any other stories you'd like to share before we?
Sometimes, unfortunately, we can only save. How can I put it? Sometimes the babies are too premature. You're not even halfway through your pregnancy.
Yeah.
Like your 22 weekers. Those are.
You never really know what you're going to get. And you have to cross your fingers the entire time.
There's a 50-50 chance for those 22 weekers, I would say. Like, or even if they do make it.
I would believe it would be close to 50-50.
Exactly. So 22 weeks is what, like the lowest we try and save. Just like think about life expectancy. Sometimes like genetics plays a huge part in the outcome of some of these babies, the diagnosis. Sometimes they're just not ready. They're just not ready to be here. And sometimes it's like, what's the ethical thing to do if we know a baby, wouldn't even make it past the first year,
Yeah.
just to give them comfort and just know that they're just felt love during maybe the short time that they were here. I'm not a mom. I can't make those decisions, but I would think that's what you would want for your baby instead of like prolonging what's gonna happen.
Yeah. I think that that's such a big issue, not only with preemies, who obviously cannot advocate for themselves because
Right.
they're not even a pound sometimes.
Exactly.
But I think that issue goes into just people in general. So it goes into this whole conversation of the
Super tricky conversations.
very philosophical, the right to die, and the right to quality over quantity. And you do see it in the NICU a lot because, of course, it's their baby. And again, I've never been a mother either, so I don't know what that even feels like. And I think some of it even has to do with a lack of medical knowledge.
Education.
Yeah, education in general of, okay, well, your baby's brain is this, baby's heart is this, your baby's lungs are this.
Can you take care of your baby if they are old enough and they go home on a vent? We've had that happen where we take care of babies for months, closer to years. They go home on a ventilator
And they don't make it.
and they don't make it.
Can you handle a trach at home?
Can you handle a trach at home? Can you do your baby's care? Like if social work gets you help, would this be a setup that your baby can go home to? Sometimes our parents are homeless and the hospital helps them with resources, but we have to be realistic,
And I don't know if that's, everyone talks, of course. We're in a NICU full of women.
Right.
And sometimes it'll be like, oh, well, the providers aren't telling them straight up.
Right.
I hear that often.
Right.
The providers never told them, like, this is what their life is going to look like. So that might play a role into it. But it's also like everyone always hopes and just wishes that their baby is going to be that miracle.
I know.
And I don't blame them. So you do see that quite a lot.
Too many times.
Too many times.
Mom's love, right? Like anything's possible, but also it's like, would you want to sit in pain for the rest of your life?
Would you want to fight for your life for the first
Every
year?
day, get infections, go back in and out of the hospital.
Fight for your life every single day and not even make it to your first birthday.
Right.
It's like sometimes.
Yes.
But I think that's where it's great that, oftentimes if a mom is high risk, then they will, introduce them to the NICU very early.
Yes. Yes.
And they'll do a whole tour and then they'll start talking about this is what your options are.
Yeah.
If X, Y, and Z occurs. And I think that's such a great step in the right direction because,
You're setting them up for success.
Yeah. And it's
And
like,
giving them
okay,
options.
if my baby isn't viable and would probably be almost tortured in a way if we took him to the NICU, maybe I can do some skin to skin
And hold.
and have a beautiful moment with my baby. And that'd be it. So I think we're headed in the right direction, but there, of course, there's a lot of changes that still need to be made in that direction.
I agree. It's such a touchy subject.
It
So
is.
how do you present this in a manner which they understand and they feel like they're being heard and validated? But even sometimes you do all this education, it's still not, it's probably really traumatic. But I know a lot of nurses that I work with that do such a wonderful job of taking care of these kids. Like maybe some are going to make it. And like, even though the ones that are not, you're helping them kind of like move along in their journey. Right. And they're just made for it. They know they know how to talk to like parents and present things in such a way where it's like, you're going to look back and be grateful that you had these people in your NICU journey. Right. Like I said, some nurses are better at talking with parents. Some nurses are better at dealing with like chronic babies, like your micro preemies. I do see a lot where I'm like, I don't know if I could do that, or maybe with more years of experience and more confidence, like I'd be able to do that effectively. But some of them just do it so well.
I know. I'm like,
So well. There's like, I don't
What
even
would this
know.
NICU be without them?
No, literally, like, don't leave. Like,
Don't leave.
everyone can leave, but like, you cannot leave.
So, what unique skills do you think a NICU nurse needs to have that may differ from other types of nursing?
Sharp assessment skills, because babies can't talk to you.
Oh, absolutely.
You
Yeah.
have to notice any slight or subtle changes. Sometimes you get to know these babies well, because let's say you work 3 shifts in a row and you have the same assignment. If your baby's not as feisty and that isolate, like swatting you away, like when you're changing the diaper, like the vitals, like he's having too many like Brady's, too many DSATs, if like his bowels are loopy, if he's not pooping, no bowel sounds, if he's requiring more oxygen, those are all small things like, an adult, maybe whatever, but in super subtle.
Absolutely.
Check those diapers. Do they have poop in those? Do they have blood in those poopy diapers? Like you have to check these things. Like your lungs sound. Some of these kids, they come, and they're term babies, and they're on CPAP transitioning. They need a little help, and then all of a sudden, it's like, oh my gosh, why am I up to like 60% on my O's? A pneumo, a chest tube, workup. Did you listen to the
happened
lung
fast.
sound? Yeah, get
Literally.
an X-ray. Oh my gosh, a pneumo. And then sometimes you learn the babies where it's like, okay, well they do this, but always just kind of like backtrack, like, wait a minute, has he done this before? Just make a note of it. Chart every time that you call the provider about something.
Oh, yeah.
Because then it'll become a trend, and then they'll be able to see, oh, the nurses have been concerned about this. Let's do something about it. So good communication. I feel like the rest is like good communication skill with your providers, with your coworkers. Like, let them know, like, hey, I'm getting an admission. I don't know when, but maybe you'll have to feed a baby for me. Like,
Absolutely.
learning how to communicate with parents. I was so bad at that. I would dread having, when I was a new grad, dread having parents in the room. I'm like, I don't know how to talk to them. I feel like your baby is well taken care of, but I don't know how to tell you that.
Yeah. I don't know how to
Can't you
communicate.
just see, like,
Especially because you went straight to, I think, what may have hindered that. I've seen you in action. You're amazing at it. But I think what may have hindered that is that you never really had to communicate with adult patients.
No.
Like you did when you were younger, but like on an actual medical level where you're having to explain things in
or
layman
even people
terms
my
and-
age or younger
Yeah.
than you.
Yeah, so you have to, like, you get that practice when they're actually your patient of explaining why you're doing something and all that. You don't get that practice with the babies. So then the parents come in and
You're like, oh, I gotta talk. It's so, and then they're like, how's my baby doing? And like, the moms sometimes are super stressed. Like, they just had a baby, they're in pain, they don't know you. They're like, who are you? Like, what? They don't know what NICU is, right? Let's say they just land there, their baby. They're like, I don't even want to be here. I don't get what the point of this is. And it's like, okay, your baby is little. If they don't have this CPAP on, it's that balance too. And I feel like I've gotten so much better at it as time has gone on. And honestly, like, listening to other nurses talk to parents, huge for me. One of my preceptors, she was a NICU mom. I love you, Sarah. Thank you for thank you for your patience. She would literally have to, like, there would be parents in the room and she'd be like, I'm like, okay, Sarah, I'm going to go in there and I'm going to say this, this, and this. How does that sound? She's like, yes, Jen, you can do it. Go in there. Like, I'm like, okay.
Yeah.
Like, I don't want to go in. Like,
No.
no, literally. And then like the parent, you have to gain that confidence in yourself because the parents are like this, watching you do every little thing to their baby, and they'll be like,
Oh.
and I'm just like, please.
Yeah, that's why also it's important to be nice to your nurses too, because
Yes,
if
please
you're
be nice to us. Please, we're
you're-
really just
I know, we're just trying. When someone is looking over you and judging every single thing that you do, it makes you almost worse at your job. It doesn't help anything. Ever.
yeah.
But going into what you were saying about, moms who are uncomfortable, I think it's very important if you become a NICU nurse to be able to step back and always remember that empathy is so important, because in a normal birth, baby would go home with mom and mom would be in charge of everything.
Yeah.
How long did the baby sleep? What time did he poop? When's the last time he ate? What is he taking? Mom would do all of that.
And they know.
And they
they
know
have it
everything
all.
about their baby. And then now, instead of any of that, their baby is in a strange place.
We're telling them what's going on with the baby. This is what your baby likes and doesn't like.
Exactly. And so now it's, now a stranger is going, oh, well, he doesn't like that. Or,
I know.
so you have to take a step back. And I always try to remember, if a mom is mean, I have to just take a second.
Yeah.
They lost all control, and this is how they're
so
showing
true.
it. And also, think about how devastating that would be in a normal state of mind, but then to also have just given birth.
Yes.
And your hormones are like,
out of
bing,
whack.
bada, boom. You can't even keep it straight. And
Yep. You're tired. You haven't slept.
You haven't slept. And now your baby is in a strange place. And you have to do all of this extra work just to see your baby. You have to drive all the way there. You have to find parking.
You have to pump. You still have to pump.
You have to look in this little tiny camera and look at your baby to help you pump.
I know.
And it's just so stressful. And then you're also dealing with life is hard enough on top of it.
Yeah, just your other regular day-to-day stuff. You have other kids at home, and how do you divide yourself between your kid in the NICU who's sick and your kids at home? I commend moms. I really do.
It took me a second, but one day it just hit me, and I'm like, it's okay. She yelled at me just
fine.
because I was communicating something.
Yeah.
And that's all right.
Keep it
she has
pushing.
a really hard time right now, so it is what it is.
Give her a pillow, a blanket. Can I get you some water? I'll be
And
back.
then you keep it moving, and you don't take it personal because it has
No.
nothing to do with you.
No, and just show her that I am the best at taking care of your baby. Even if maybe you and I aren't clicking right now, but rest assured, anything going on, I'm talking to the doctor. I will be in there.
I'll catch it, and I'll be on it, and maybe we'll get along another day.
Exactly. See you tomorrow.
Because I'm going to sign up for your baby. No. Do you have any stories of resilience or hope that you'd like to share? Yeah.
Yeah, all the babies there are an example of resilience and hope, and a lot of the parents too. Sometimes you do see miracles where it's like two babies I've taken care of where providers were like, I didn't think he was gonna make it, and they're home and they're doing normal baby things, walking, taking bottles home. Obviously, they have to follow up, with providers like outpatient, but they're home. And those are the times where I'm like, a mom's prayers, right? Like sometimes sometimes they do beat the odds, and a lot of them, all of the babies, come on now, like you're out the womb already, like, oh my gosh, I need so much help.
A miracle.
You were a miracle to begin with, to even be born. Like, and some moms too, that they go through like IVF, and they have such a
that breaks my heart.
Yeah, like they have a hard time conceiving to even begin with. That is a miracle. And I'm lucky to be able to take care of those babies and those families and get to listen to the story. So it's literally like at home, any slight inconvenience, I'm like, all right, Jen, like, come on, like, get it together. Like, there's real problems out there. There's real problems out there in the world. So
absolutely, yeah.
I don't know about, like, it does fill me with a lot of hope and a lot of caution sometimes too. Like let me, I don't know, like maybe like when I have kids, like I'm going to be so cautious, like do all these tests, make sure like genetics is good. Like,
absolutely.
Make sure like I'm okay to have a child, like, all those things, which is weird because some moms come in with no prenatal care and their baby's like bouncing and perfect.
I know. I'm like, it's always the ones that didn't have to try, or like the baby was a oopsie.
It's like, oh, and they're perfect.
Literally.
They're perfect.
Literally, some people just have to try so much harder. And it's such a good example, like you said, of resilience and hope.
Absolutely. Every day. Every day.
Mm-hmm. We have the best job.
It for real.
If you have to do
bedside,
NICU is where it's at. Mm-hmm. In my personal opinion.
Yeah.
I wouldn't do anything else.
Some people can't handle seeing, they think it's really sad from what I've, in my ER days, when I was there. Yeah, we'll get to that. They were just like, I can't do it. I can't look at a baby that's in the hospital and say, some people can't do it.
But it's not as bad as you think. Even on their worst days, it's like, oh, this, even when they look kind of crazy because they're septic and swollen, and it's still a beautiful baby.
I completely agree. And it's just like, I have all the power I can to make you look like cute and presentable, like for your parents and
Yeah.
stuff. And like I can do that. With adults, it's like, I don't want to take a bath. It's like, okay, well, I can't do anything. Like if you won't let me,
Refused. Don't mind me, sure.
or it's like, come on, like let's shampoo your I don't like let's do it. No, I don't want to. Okay, well, I gotta walk in here every day and see you like this, like or smell you, or like like I just want to. But they don't want to, and you have to respect that. With a baby, it's like, here, have a passy. We're gonna be a little bath, swaddle. Like you're gonna be perfect.
I'm gonna put pants on you and make you look so cute. I don't know why, but a preemie baby
Yeah.
in a pair of pants. I'm like, it gets me every time. I'm like, I always go, even though it's kind of a pain in the butt when you have to like change your diaper every 5 seconds.
No, literally.
Oh my God, a pair of pants on a baby just gets
Literally.
me
Or
every
when like the
time.
holidays are around right now, like that have little crocheted pumpkin hats. I'm just like, a little.
And I'm like, that's where you're like, wow, I'm so glad I'm a NICU nurse.
No,
For sure.
every day.
Every day. How do you take care of yourself when the outcomes are not always positive?
I feel like as time has gone on, almost 3 years now doing this, I have learned to put up boundaries. And sometimes as nurses, you talk about work 24/7. Your
Yeah.
friends are nurses.
Yeah.
Your closest people to your medical. That's just how it is. You're out with your friends, dinner. You're talking about work. It's like sometimes I feel like it's so hard to escape it.
Yeah.
But you have to compartmentalize sometimes and be like, I am going to go for a walk. On my days off, I am not going to pick up. I'm not going to pick up. I have to take care of myself. It makes a huge difference in your level of patient care. How I'm so big on self-care. That is a hill I will die on. Yesterday, I worked 4 shifts in a row. Yesterday, I did self-care. Do whatever it is that you need to do to feel like rested and at peace. Like light a candle, put on a face mask, go for a walk, call your friends, call your mom, call your parents. Like if you have a faith, lean into that. Like you need to figure out what it is for you and do it. And just sometimes like when I went on vacation, I like pause like the work Facebook group. I was like, I don't want to know how short we are. I don't want to know. I don't want to know that you need nurses tonight. Like
Yeah, because I'm not coming in anyway. So
because I'm not coming in, like I will do my due diligence. I will work my shifts. And yes, I have picked up here and there, but there are nurses that can go ahead and work 5-6 shifts in a row. And thank God for you. We need you. But sometimes if you need to lower your FTE for a little bit, I had to do that. When I first started nights, I lowered my FTE. I had to do it for like my little mental health. But it's gotten so much better.
Good.
Recognize the signs before it becomes like way too much. Like eat well on your days off.
Yeah.
Work
If you need a
out.
moment, take a moment.
Oh yeah.
Because people can feel it when you don't.
Absolutely.
Parents can feel it.
Yes.
Your coworkers can feel it.
For sure.
And everyone's going to have a moment.
Yeah.
Take a step back.
Yeah, if the babies are too much crying, swaddle them and step out for a second. Just step outside of the room, go get a bevy, go get your coffee. I don't know, go get your Starbies and just come back. Just take a moment. Like no one's gonna fault you for that. At least I'm not. I'm certainly
wouldn't
not.
either.
I'm certainly
We've all
not.
done it.
I've definitely had a
3
cry
a.m.
or two.
Oh my God.
Yeah.
I'm like, I need to step away. He's
For-
going to cry for a second.
Yeah.
I'm going to take a lap. I'll be right back.
No, literally.
You have
And
to.
Yeah, but you need.
Especially nights.
You need to
Nights
put.
will test your mental so much.
Yes, it will. Especially at 3 a.m. when the nausea rolls in, you're like, oh my God. It's like, that's when it's like, just step away for a sec. Like, the baby will be fine. There's other people on the row. We'll watch them. Many a times only a couple times, I've cried in the bathroom and come out like, okay, I still have 12 hours. I didn't even go to huddle because I was so distraught, but
I used to feel like that when I worked nights.
Yes.
Because I was so nauseous and then I'd get like palpitations
Or like, I
and
didn't sleep enough.
tachycardia and I didn't sleep enough or whatever. And I would just come in like, I would get literally like you said,
On
and I
10.
forgot
You're on
about
10.
it. I would literally come in like and have to sit down and be like, am I okay?
Yeah.
Like, am I going to pass out?
We've talked about this.
Yeah. Like,
Yep.
because I was just so ill. My body just didn't handle it very well.
Nursing will run you into the ground. I don't care what kind of specialty you're in. If you're doing bedside, you need to watch yourself. I know so many nurses that have literally gotten like so many stress reactions I
Oh.
had when I lowered my FTE, I was like, listen,
What'd you go down to?
like 0.75.
But still, that makes a difference.
Yes, it does. Because it's like if I want
That
to
week
work
of
3,
two.
yeah, it's like
Oh, you're like, thank goodness I can do it.
exactly. It's like I only have to do 2 and that's it, you know? Put yourself first. I'm not, at least and I feel like this new generation is not going to fault you. I feel like this new generation's like, do what is best for you. Enjoy your time off. Let the hospital worry about staffing because I'm not. So put yourself first. No one's going to.
No one's gonna put you
No one is
first.
going to put you first. Not your best friends. I mean, you have your friends and they're, but
And they love you, but
and they love you,
they're
but
trying
they
to get by
can't,
just
they
like you
can't
are.
live through you, and
Exactly.
you need to be strong to be able to come in, do your job, support these families, support the babies, because they feel your energy. If you come in pissed, the babies will be pissed at you.
Literally.
And it's like, don't touch me. Don't. The babies will literally be like,
I've had parents say like, okay, when they can literally tell from just watching them on the camera that if
having a
it's,
bad night,
if someone's having a bad night, they can see that their baby
aggravated.
is aggravated or acting different.
Yeah,
Crazy.
you're holding their entire body in your hands. Like you don't think that they don't feel like you're angry
Yeah.
or upset. That's a firm thing I believe on. People can call me crazy. I don't care. They feel the energy in
and
the
how
room.
you talk to them.
Absolutely.
If you're
Dude,
like in the
Yeah.
room, or if you're like, oh my goodness,
I know.
they're gonna know.
Literally, no, that is a thing. I don't even know if it's scientifically proven, but
It is
proved
here.
it time and time again. It's been approved.
Yeah. What advice would you give new nurses or new grads considering NICU as their first specialty?
Do it. If you know that you love it, do it. There will be people. I was told not like, first of all, I was told in nursing school, like, that's never going to happen. You need to go work med surg. All of my friends, they told us, you need to do med surg first. You're not going to get hired into a specialty. How did 2 of my friends start in cardiac ICU and me and my good friend started in NICU? Network.
Absolutely, yeah.
That is such an underrated thing. Be confident in yourself and approach people. Like hiring events all the time. Network. It's nowadays I feel like people think it's so hard to just go up and strike up a conversation. Like I understand it is, but think about how bad maybe like you want this. You never know who knows who. Like network and ultimately be kind to yourself. Mm-hmm. Be kind to yourself when you start in this specialty because you will make mistakes. We are human. We will make mistakes, but learn from those mistakes. Don't just brush it off.
Yeah.
Or when someone gives you, when someone's giving you constructive criticism, take that. Mm-hmm. If someone's just being a jerk, yeah. Someone's literally just being an ass. Like, just be like, I'm good, thank you. Like,
It is what it is.
It is what it is.
You go over in that corner and I'll be in this one.
just be humble. I didn't come in being like, I'm a new grad and then no, I'm grateful. Thank you.
Thank you.
Thank you
Yeah.
for hiring me. Like, thank you so much. Your attitude goes a long way. That's what I would
Absolutely.
say.
So a little while ago,
Mm-hmm.
you ventured off to make a change and you went to the ER.
I did do that.
How long did you stay?
I did 3 months.
3 months. And then she came back.
I sure did come back.
How would you just want to kind of
Brush up on that.
yeah,
Venture?
tell us about like your experience. So obviously you were only there for 3 months, so it wasn't like the best, but I want to hear about it.
Oh my gosh. In nursing school, I knew it was NICU or ER.
Okay.
And then NICU just was it for me. Like I told you, like I fell in love. And then ER was very close second. I spent a lot of time in the ERs when I was like in school and stuff. I loved it. The fast pace, I really liked it. Which is weird because people are like, how does that even work, right? Like you love the NICU, it's such a specialty, and then now you're going to the ER, And I was like, no, like I really want to try. Like I'm young, I'm early in my career. This opportunity is being presented to me. I think I should take it, Like I was kind of getting burnt out a little bit and wanted to venture out and see what was up. So I started in a freestanding ER, which I thought would be better than like a level 1 trauma, Like if we were to get patients that require that, were level ones, they would get we would stabilize them and then transfer them to the main hospital. So I started here, and like a month into me being in the ER, I got injured. It was non-work related. I just personal health stuff that was going on. I got an injury and I was out for a month. Like, it was really bad. I don't even want to get into it. It was just so awful. So I had to go to physical therapy. I'm still doing that. And so I got back as soon as I could. I'm like, this is crazy. I just started this. They're going to think like I'm just so irresponsible or whatever. I'm like, I got to get back to it. I went back. I was in absolute pain every single day. These patients are
huge,
ginormous.
Like, let's just be real.
These patients, I'm like a whopping like 300 pounds. And I'm just like, let's go. Like,
oh yeah,
just me, I feel like I also came into a time where like the unit was going through, that specific unit was going through a lot of changes. Like, they had just gotten a new manager. And so, there's always, how that goes.
Yeah.
When there's restructuring up there, some people are like, oh, like I don't like this new manager. Like, we're all going to quit. And like, I guess that's what was happening there. A lot of like higher up stepped down. A lot of people were happy with the change. Like, but I didn't know this, right? I'm new. They try to like shield you from that.
Okay.
So I was like, is it me or is everyone like really crappy? And then I come in and I'm just like, hi everybody. And some people were like, who are you? Like, what are you? Like, you came from NICU? That's not even real nursing. I had a provider once be like I was just busy. Like, I don't think they understood like everything we do is in mini. Mm-hmm. Right? Like, if we're running medications, it's over a period of time. You can't just flush something through an IV, and I'm just like, you guys flush that heart med just like that? And they're like, yeah. I'm like, oh my God. Okay.
Yeah.
It's,
you can't do that to a baby. That's 1 pound. You can't
do that to a baby. No, everything is so and like I could feel people getting frustrated with me because I wasn't moving fast enough, and I wasn't, and like, I just didn't want to make a mess in my rooms. Like, I'm sorry. Like, I didn't want to have, but like, I understand the urgency of things, right? So they were just like, who are you? What are you doing here? I had a provider once be like, are you missing the NICU yet? And I was like, no.
Driving home.
And I'll just be like, I feel like the huge difference was that I feel like there is teamwork in the NICU, the unit that I came on, because let's be honest, a lot of the nurses there have been there a long time. They know how to work with each other. And this unit, maybe because of the time that I came in, but I feel like they didn't get along. And so I was just like, listen, if I had a bad day in the NICU, like, I could go out in the hallway and just kiki it up with y'all, I would come out and everyone's just miserable. Yeah. And other things so it was the culmination of, I was in pain, like I was recovering from an injury. I was still in a lot of pain coming back to work. The culture was a huge shock to me. And I had such, like, my original preceptor went on vacation, and they put me with this other nurse who absolutely hated me. She despised me.
Oh my God, that was so horrible when you're trying to learn, because you're already so like tense and, anxiety ridden and just all over the place, and you don't know anything, and someone's then being mean to you.
And you have to rely on this person, and they're just like,
could get away from me, you're annoying.
Yeah. Vibes like that. Like, I don't even like, I stood up to her though, and I feel I did. I was like, you know what? She was trying to tell me that I don't have a good relationship with the provider. She's like, I don't know how I was on your old unit, but our providers are right here. Like, you can grab them anytime. And low key, I'm like, yeah, like, you don't know how I was on my old unit. You weren't there. And I have great relationships. I had great relationships with all my coworkers, like, even if I didn't personally like everyone, I would always just try to be respectful
and very
work
nice.
Together.
You're always so nice.
I try to be, dude. Yeah,
but,
like, so I was like, she put that on my eval.
So you have a bad relationship with the...
She told me I had a fuck you face. She sure did. I'm just being real.
Yeah.
Like, because this is stuff that nurses go into a new field, a new specialty. They want to try something new. And then this is why everyone's leaving bedside.
Oh, 100%. Because it's scary enough.
It's scary enough.
The job is scary within itself. And then you have someone who's treating you like crap.
Yeah.
Like,
and
I would cry before I would go to that shift, probably.
Yeah.
Like,
but no, I was like, she put all that on my eval, and I was like, well, and then at the end, she was like, well, I'm sorry I had to write all that. I said, you didn't have to. That was a decision that you made. You didn't have to do that. She's like, you can throw it away. She's like, you can throw it away, rip it up. No one even, and I was like, no, that will stay there. I was like, that will stay there. Keep it pushing. And then I was like, you know what? I'm in pain every day. I just had a better thing where I was like, I don't have to do this.
Yeah.
And that's on boundaries.
Absolutely.
And that's on like, this is not serving me.
Life is hard enough. I don't need to make it harder for myself. Let me just.
Exactly. So I was like, I learned a lot. I will forever be grateful for that, because after that, I'm just like, I don't really care what you think. And I used to care so much what people thought. I used to care about every little thing. And I'm like, oh my God, this person looked at me like this. Oh my gosh, does this person think I'm dumb? Oh my gosh, does this person are they going to go talk about me? Now, after that experience, I'm so grateful, because I'm like, you can think whatever you would like.
I'm going to come here, do my job.
I'm going to come here, do my job. And I've never been pulled back into an office to be talked to. So seems like I'm doing something right.
Absolutely.
You know?
I'm sorry you went through that.
I'm not. I'm very grateful.
Did you collect any memorable stories from the ER that you'd like to share?
Yeah, I have a couple. Honestly, although my time was short, I did build good relationships with a lot of nurses. Like, so when they found out I was leaving, they're like, were we that bad? I was like, no,
not
all of you. No. And honestly, sometimes like through secure chat, like I'll still talk to some of the nurses. Like we added each other on Instagram, even though my time there was short. So I'm like, it's okay. Not everyone's going to like you. You're fine. Just move on. Be confident in yourself. I know that's easier said than done, but every nurse will get there in their journey. But for sure, there was so many crazy things. Like there was this one guy that he came in, he was like a limb alert, like trauma. He came in, this guy, young guy, was fishing. And I guess like he lost his balance, or like the fish was too big or something. And he fell like on all these rocks, and his femur was sticking out. Like it wasn't even attached to his ankle anymore. It was just out. You could see the bone. And it took like 4 providers, like 2 paramedics and 2 providers, to try to like set it back into place. Blood everywhere. They had to do like a conscious sedation, but he was like coming in and out of sedation, like consciousness, and like he was bleeding so much that they were losing grip on his foot and leg because it was just so slippery. And I couldn't look away. I was like, this is so cool. Like all the things I was learning, like I enjoyed it.
Yeah.
And all the paramedics were like, help the provider, like 'cause she was a lady. And so they were trying to like set this bone back in place. I don't even think they were able to, because it was just so bad. They flew him like to the main hospital to get that figured out. I've had patients come in with like the JP drains full of feces. I've never smelled anything like that in my life, ever. Drains full of drains to like drain like surgical, like blood, stuff post-op. Poop in the JP drains. I've had patients come in from off the street, like swinging, and I'm just like with my rover in between them, like they looked like they wanted to kill me. Patient, like just off the street, and it's like he just came in. He was like schizophrenic. He was actively manic. Like he just was like, people are out to get me, blah, blah, blah. Like, and I didn't want to set him more on edge. Going from that preemies to that, I was like,
a shock.
Yeah, it was a shock, but I'm glad I did it for the short amount I could do it. Just patients yelling at you, moms almost giving birth, which of course, like they were like, Jen, go in there, like you know what to do, like.
No, I know, that's completely different.
Like they didn't know how to, like they're like, oh my god, the baby, like oh my god, and every time it was like baby, really, it's like, Jen, go, like, and I'm just like, this baby's fine. He's like taking a passy, like he just got a bump on his head, like he's fine,
What was the picture I saw of you when you were like,
Oh, and with the hazmat stuff, we went through so much in like my ER program that was like training me. They prepare you to do like mass casualties. So like if there was like bioengineering, like just like a bio threat, like they had us do this training or like a mass casualty. They have you put on these hazmat suits and like clean people so that they could be treated. So we did like a drill. So all these providers in the ER would come and they would put us in these hazmat suits. And a lot of people backed out because they're like, I'm claustrophobic. And I was like, I'm claustrophobic too, but I will do it. Like, what, like, put me in there. And I was in the suit, like hopping around and like, and real volunteers, they got hosed down. These like high school kids. And like, I felt so bad. The water was freezing. And I'm just like, you're just doing this for fun. But I'm like, close your
oh,
with like the hose, and they were like, it was triaging patients, like who's gonna make it, who's not gonna make it, who could maybe make it. So you got separated into like like they triaged you based on what resources are available and what we could actually do for you. So
oh, wow.
the hospital, I think it's great. We live in a big city. You never know what could happen. They've never had to activate it, but
You never know.
you never know. So they're really prepared for that.
Did the freestanding ER, kind of like ours in the main hospital, did it have the built-in oxygen into the hallways and such to take care of like a larger number of people?
No, I feel like we were never that full. They had like the rooms were kind of set up for more high acuity patients, and then the like kind of they made it kind of like it's kind of like urgent care. You walked in, it was something small, and we can get you out right away. But when I did have some shifts at the main ER, those nurses are amazing. The codes are run so well. ER nurses are a different breed. I commend them for that. You have really great nurses that are on their P's and Q's, providers, like the energy in the room when like you're there and you're waiting for like a trauma to roll in and you're seeing everybody have a role. I really enjoyed that. You had more hands around than you really needed. Like you had to kick people out to be like, hey, we have enough help. Like that is great teamwork. And I, even though I was there for a short time, I did learn from a lot of really good nurses. So it's not all negative, but you know, life.
I think it is a blessing because I feel like sometimes people that you went to the ER, because I feel like sometimes people who have never experienced anything else kind of lose their appreciation for it. And then you go out there and you deal with 300-400 pound patients or people actually like physically trying to hurt you and all these things. And you're like, wait, the NICU is amazing.
I've come back and I'm like, thank you. Thank you for taking me back. Like my managers thankfully were just like, yeah, of course you can come back. Like, you know, I'm even grateful for that. Every day I come in, I'm like, I had a rough shift. My babies were so sick, but
I wasn't in the ER with those mean nurses.
No, I wasn't trying to get assaulted by a patient. So a win is a win.
Absolutely.
Yeah.
So what type of nursing do you plan to focus on in the future?
Definitely have thought about going back to school for like maybe like newborn nursing, like a newborn nurse practitioner.
Yeah.
Not neonatal, more of just like the newborn side of stuff. I think unfortunately it's a real thing. Nursing bedside is just becoming unsustainable. As much as I hate to say it. You know, as much as you want to do your job, it's like more and more things are being added on, more things are being taken away. It's not sustainable in the long run, especially for floor nurses. I have a deep found admiration and respect for floor nurses, ICU nurses, like adult ICU nurses. It's so hard on your body. It's so hard on your mental health because I see it. A lot of my friends are nurses. We talk about these things. It's seeing death so often. You know, I wish like sometimes hospitals would just make it a little bit easier on us, more resources, because it's not a new thing where a lot of people are leaving bedside.
Oh, absolutely.
And they wonder why. I know why.
I know why.
I know why. which sucks.
It's just too much.
It is too much.
I commend the people who can do bedside for like 15, 20 years. I'm like, how did you do this? How? I could never. I don't think I could ever do bedside that long. Even if it is with the babies.
Even if it is with the babies, because you're running around. Like, don't get me wrong. Like, I love what I do. I love the baby so much. But it comes to a point where it's like, we're going to get older, you know? Like, we got to take care of ourselves. So I will leave bedside eventually. And it's going to suck because I love the kiddos. And, like, I've grown more confident in, like, building bonds with families, but eventually, you know, your personal life, sometimes in your professional life as bedside nursing, they're not always gonna like mesh well.
Oh, absolutely, yeah.
So you just have to learn how to navigate that, especially if you're a new grad coming into the NICU. You have to be aware, like, if I ever do want to leave bedside, I'm gonna have to change everything, how I think, how I chart, how I assess patients. Because let's say you go outpatient and you start working with adults, you're gonna have to learn all that. So just be prepared for that. But it is very rewarding. I wouldn't change it. No.
I think you'd be an amazing nurse practitioner.
Oh, thank you so much.
Yeah. Okay, so if you could go back in time and give yourself some advice when you were just a little baby nurse a couple of years ago,
Yeah.
what would you say?
Nothing lasts forever. So the hard times are not going to last forever, and enjoy the good times too, because that also, you know, fades away with time. Like, you won't forget the feeling, but maybe you'll forget some of the details that stuck out to you in that moment. So nothing lasts forever. Be kind to yourself. If you can, and you're in a good unit, like, just build relationships with your coworkers, even if it's just work, that's totally fine. And don't forget to just speak up. Like, what's the worst someone can say is no. Take a chance. Do what scares you. That's what one of my professors told me. I was like, I don't know, NICU. He's like, you got to do what scares you. So that would be my advice. Yeah, my takeaway. That's what I would tell baby Jen. Yeah.
And it's okay if in the beginning everything scares you, because
Literally
a lot of
everything.
a lot of people feel that way.
Like changing a diaper, I was like, like, oh my god,
Yeah.
it's like he burped.
Everything's new.
No, literally. So like, don't feel dumb. Okay, like, I wasn't a mom. I'd never worked with babies before. I didn't know diddly squat. So
Neither did I.
And now here I am, like, teaching parents how to be parents. And
I know. It's so rewarding. Like when you think of yourself in the beginning. I remember the first day I ever fed a baby. I was like, she's not eating anything. She's not even like sucking or doing anything. It was my first time. And Carly was like, yeah, because it's taking a breathing break. And I was like, oh.
Or give her a second. She's like working out a poop, and you could see it in their little face, or just trying to like.
And I'm like, oh, that was stupid of me. Duh, she needs to breathe. Her mouth.
But it's not even parents that have normal newborn babies. They're trying to feed a preemie, and I'm like, let's not drown them with the milk. That's a little too fast. Like, you know what I mean? Yeah, it's all enjoy the process. Like.
Cry
it's funny.
if you have to cry.
You're gonna make the dumbest mistakes, and I still laugh about all the dumb things that I used to do. And I'm like, my coworkers probably think I'm an idiot.
No, honestly, yeah, and you're gonna think about it when you're trying to go to sleep at night.
Yeah,
everyone does it. Everyone does it. You'll be laying there, finally got to sleep, and then you'll be like, remembering what you said. That was so stupid.
Or asking like the dumbest questions, and everyone's like.
You're like, wait, actually, if I would have thought of that.
And then you think about it, you're like, oh, I knew the answer to that. That was a clear no.
Yeah. Or if like you just took 5 seconds to ask yourself the question before asking someone else. Yeah.
Yeah. No question's a dumb question, though. Like, if you're new, ask, because you don't want to feel like you know something and then
mess up.
Yeah.
And hurt someone.
Yeah.
Always
find a safe person. You know who those people are. Find a safe person and
Absolutely.
Ask away. Yeah.
Okay. So if someone were to come to you and say, I'm really thinking about becoming a nurse, would you recommend it?
I'd say if you found a specialty that you really liked, you need to find a specialty that you find rewarding. I can't say you're going to find NICU so rewarding, because what if you're not a baby person? Like, you know, some people are like, I love my babies. That's fair.
Yeah.
So you need to find a specialty that works with like your life, a specialty that works for you, and pursue it. But just know that it, very rewarding, but at a high cost too. So
At a very high cost.
at a very high cost. Yeah.
Absolutely.
Yeah.
I like that advice.
Yeah. Honest advice here.
No, absolutely.
Yeah.
Well, thank you so much for coming. I had such a good time.
And me too. Thank you so much for having me. It was fun.
Of course. All right, guys. Thank you so much for watching. We will see you in the next one. And before you go, please don't forget to like and
Subscribe.
bye.
Bye.